Guys, are you a nurse? Have you been working in a private hospital in Kenya? Maybe you're lucky. Have you been working in a dispensary in Kenya? Or in Africa? When you come here, that's the only time you realize we are in a third world country and we need to improve on our healthcare system. Hold it up there. Are you working in a level 5 hospital like Kenyatta National Hospital, Mbagathi, Kenyatta University, Moi Referral Training and Referral Hospital? Like those big hospitals, government hospitals. I understand KU is a bit better. I think it's in terms of like private or something. So where are you working? If you're in this journey, my friend, try going to those private hospitals at least for local mama for orientation. It might come in handy. For me, let me say I was kind of lucky. I was working in a government hospitals. Guys, by the way, I was working in one of the best hospitals in Kenya. Sini ukweli. Yeah, it's the best. I was working in one of the best hospitals in Kenya in terms of pay, but I was still complaining there is no money. So and then you find that hapo hivyo there are some things that we used to feel if you stay here for long you'll rust, like utakuwa mrusty. There are some things that you might miss out. So I used to do locums, like I used to do some locums nenda Mpishaga can, like private hospitals, because you see private hospitals normally have better infrastructures. Like you might find they have a better system, like such kind of, you know what I'm saying. Alafu unapata, if you're in this journey, you tell yourself, let me go and start talking English so that when I go there, I will be able to speak that English of the nose. So I was trying to go there and start practicing to speak to patients there because they speak English, and back where I was working, they speak even my career. So, where do you know when you come here, you have to use English even when you're annoyed, and you have to smile even when you are annoyed. Like you have to get used to smiling. Like when I was training in Uganda, there's this culture that Ugandans have that even if you're coming from the toilet, they will tell you well done. You know the Ugandans, the way they are humble. Guys, don't come to me. I'm just saying in a good way. I'm one of you guys. I'm saying like the way you find them, they tell you like the way they are humble. Even if somebody is mad at you, they're still humble. You guys will be lucky when you come here because it will be very easy for you. You'll smile even if there is nothing to smile about. You find somebody, like you're walking across the street, you'll even end up getting Sodonica's smile. Guys, am I getting the smile? Smiling. Even when a patient has wronged you, even when your colleagues has wronged you, just smiling all the time. You're from here, you're annoyed at somebody, like somebody has pissed you off, like you feel this is not, you need to vent out, you need a breather. But when you go to the next person, they're like, why are you smiling? What is there to smile about? Yo, that is one. Now, drug administration. It is so different here. Back home, we used to have a kabati inside the room. Me, I'm talking about where I was working. We have a bedroom. We don't have omnicell where I was working. If you have an omnicell in your workplace, oh, I'm sorry. I'm just saying where I was working. I know there are places I used to go for locums and I used to find those omnicells and stuff. But where I was working, we used to have a kabati yenye kuna madawa za wagonjwa. You pick drugs from pharmacy with a polythene paper. You come stack them in the cupboard, and then when time comes, you pick a pill, Lasix, furosemide, not Lasix, furosemide, 10 milligrams. You give the patient. Maybe warfarin. You give the patient like that. Here you have to scan the patient. We have an omnicell which has a Pyxis. So madawa zimepangwa pale ndani. It's not you to do the work. So medication error is very minimal because whatever medication that is prescribed for that patient at that particular time ndio itatoka pale kwa Pyxis. So they use Pyxis. Where I'm working right now, we are using medical administration record online. The charting system is online. It's not paperwork. So like everything, even if it's physical review and everything like you're doing for the patient, you have to do it online in the computer system. So it is very, very, very chances are very minimal for you to have medical errors, as in they have tried that one. They have tried, because like now I'll show you that video, because I tried to record for you guys, for you to understand what I'm saying. It's like a crash cart. Those guys who know crash cart, for me to use it in a simple way, it's like a crash cart whereby it has cubicles, just like the way you can open drawers. Even if you Google these things on YouTube, you'll understand what I'm saying. So for example, a patient is called Zipporah Gichohi. I have assuming this is a wristband, like a name tag for me as a patient. So you will have to go in the Omnicell, type in my number, type in your ID, because you have to log into the Omnicell, then find the Pyxis, log in with your login details, and then input whatever it is that you want. If it is the patient is Zipporah, so you'll click on the patient Zipporah. Then it will show you at 9 a.m. Zipporah is supposed to get Panadol, Pixaban, like all those medications at 9 a.m. But at 10 p.m., you know, so what will happen when you pull the medications, you'll go with the medications in the room. You will not just tell the patient, kunywa meza. No. You will have to scan the wristband of the patient to match the whatever that you're going to administer to that patient. So you'll go in every patient's room, there's a computer. Guys, have I said it nicely? Computer. There's a computer in every patient's room. You know what I'm saying? So you'll find a computer in every patient's room, and then at the end of the day, you'll scan the patient and scan the medication. It will tell you this is the correct medication, the correct patient. If it is an overdose, if it's an underdose, it will tell you on the screen. I was not able to capture that for you, but at least you'll have an idea of what I'm saying before you even land here. After this. Another thing, back home, especially where I used to work, we used to have draw sheets za kuinua wagonjwa. So you find that most of the nurses who are coming from where I was working have back issues, disc prolapse because of lifting heavy patients. Imagine me lifting a patient who is maybe 100 pounds. That is way, way, way too heavy for me, because that's the work we do anyway. You have to reposition this patient after every 2 hours. And back home, we don't have CNAs. Here, the good thing is at least kuna CNA there assisting you in doing that work. But back home, remember, you're the feeder of that patient. You're the one to turn the patient. You're the one to change that patient. Like everything, you do it wholesomely for that patient. So when you're turning the patient, here it's easier because they have a sliding bed sheet. I don't know, it's connected to the bed. So you just press the button like on the side. I don't know whether it's available in all the hospitals, but for me, I found it so cool. So if finya mahali, there's a buttons on the side, you finya them, and then the patient just slides back. You don't need to like keep on squishing the patient up and down. Then you just turn maybe 30 degrees. You just relieve the pressure that that patient has in something. So it's kind of less tedious for you as a nurse. Okay? Patient's rights. I'm not trying to say that back home we don't have patient's right. We have patient's right. But here, if a patient tells you, I'm not going to shower, it's not a priority. Just document. The patient declined. Patient declined and said they were not comfortable taking a shower. I mean, like such kind of a things. I'm not trying to say that back home patients don't have rights. They have rights. But here, if a patient says, we are not showering, respect their rights. DNR, if a patient says, I know this thing is still there, but it's not as common as it is here. If a patient says, me, when I get to a level of being incapacitated to a certain level, do not intubate me, do not ventilate me, I am on a DNR. It's fine. That's what you want. For me, it was kind of guy. Sasa amesema hata asiresuscitatiwe. Hata kama we went to school. Aji sasa, even DNR back home, for me personally, I used to feel guy was share. Why are you dying? Like, why do you want to die? At the end of the day, you'll die, yes. But here, it's so common. Like, it's so common. That is also one of the things that will make you feel guy. Mwadhani. Lifting of patients is very interesting because we have something we call steady, we have Sarah, we have Sarah Price, we have Hoyer. I'll take videos and show you how those guys are, like, how they lift their patients. If a patient is coming from point A to point B, they don't use their body, They don't use their body. What they do is they use those mechanical lifts and stuff. You find a patient swinging up. Like, it's so interesting. I think I should record myself and show you. I'll try and record a video of those lifts when I'm up, when I'm down myself, and then you'll understand what I'm saying. Like, for you to see it. Like online chatting tumesema. Back home we used to go with so many pens because you will write cardex, utaandika mpaka kidole, like your fingers will pain. Here you don't even need to think about so many pens, colors. So if you're that person who used to have red color, blue, green, here, ukikuja hapa, forget, you will not need those colors because at the end of the day you'll be chatting online. Cardex, we don't have paperwork. They do most of the things, not most of the things, but basically like 99.9% they do it online. Okay. Healthcare hapa, oh my god, healthcare hapa iko poa but not to the best. So for me as ZP, I was telling myself the other day, if for example it gets to a point that I feel I am old enough, like I can't work, siezi chapa shifts, I think the best thing for me is to just go back home. I would rather go back home because at the end of the day, if you stay here, retirement here, when you're sick, when you grow old, all systems shut down, your brain starts to depreciate. You're not even, unapata hizo sijui maugonjwa gani, like you forget things, you get dementia, or you have all sorts of conditions. I'm not saying old people are sick. Oh my god, get me right. I'm just saying the more we grow old, like the way I am right now, it's not the way I was 5 years ago, 10 years ago. Right now, even if I bend down, like I want to check something under the patient's bed, coming back, you have to call 911 to come and lift me up. Like my knees can't hold anymore. So giving myself 10 years to come, it means it will be very difficult for me to work the way I'm working right now. It's the same thing I'm saying. So if you feel like, I feel like it's not the best place, especially if you have a home, like if especially you have where you come from, like the way we have Kenya. I mean, East or West home is the best. Retiring back home and taking care of yourself health-wise, I think for me, I feel like it's better back home than here. Because, ukizeeka, you'll be taken to nursing facilities. And then, of course, if you've been to a nursing facility, you'll understand what happens. It's not the best. The other thing that I should tell you about what I feel like is so different from here, I've talked about drug diversion. This is all about nursing. Drug diversion, like watu kutumia madre. Drug diversion here is so real. Back home, I used to think that people use pethidine, like that addiction of pethidine, morphine, and stuff like that. Here, people get addicted. Even medics, they get addicted to those things. So you find that drug diversion is like narcotics. It's a serious crime. So you have to be very careful when you're taking care of a patient, especially when narcotics are involved, because you have to be careful. In short, you have to be careful because drug diversion here is so common. So you might find yourself landing in trouble because they might think you're also diverting drugs. like unatumia madre, so you would rather be very careful. In short, that's what I'm saying. Si kama nyumbani pethidine mgonjwa anapewa, because even wasting here, you see like you have 5 milligrams and a patient has been prescribed 2.5 milligrams. What are you going to do with the 2.5? Do you think you're going to put it for the other patient? NCLEX inakwambia aje, you have to discard that medication in presence of another person. Another person has to witness that you didn't eat that 2.5. Sijui kama umeget, you have 5 milligrams of morphine, or you have 5 milligrams of oxycodone, or you have 10 milligrams. A patient has been prescribed half. So what are you going to do? You will have to break that half and discard it in presence of a witness who must be a registered nurse like you, right? Drug diversion is real and it can land you in jail. That is something that we need to, like, before you come here, you see the things you're learning in NCLEX you have, I think that's something that you need to, like, let it stick in your mind. Another thing, it's blood administration. I found it to be so cool the way they administer drugs here, blood here, because you don't need to be 2 of you. Like back home we have to be 2 of you. There's something they call bridge system here. I don't know whether it's because I'm using Sana ama it's in all hospitals in America, but where I'm working we have a system called bridge blood administration system. If you've gone through that system, you'll understand what I'm saying. Like, you can just administer drug. You just input details of the patient online and stuff, like, you know, you don't need a second nurse to verify blood for